The Kansas Department of Corrections is getting high marks in its treatment against a virus that used to run rampant in prisons across the country, Hepatitis-C. Today, KDOC draws blood from every resident at least once a year to test for Hep C. With a cure and treatment found more than 10 years ago, more state prison systems are seeing a decline in the number of this once deadly virus. In Kansas, the number of Hep C cases has dropped from 16% of the population in 2018 down to 6% in 2020 and has remained near that percentage the past 3 years.
Once it's identified that they do have Hep C, we will go ahead and draw further labs, but it's after we start the medication. So at 4 weeks, 9 weeks, and then 12 weeks post-treatment, we're going to test them again. So we go through that testing treatment just to make sure that they're now undetectable, and then we kind of keep tabs on them every couple of months, and then if they identify like, hey, I have an at-risk behavior, we'll go ahead and test them again.
Along with Hep C, another chronic issue that KDOC health administrators have successfully tested for include hernias.
That's a common way of having a bowel obstruction is some bowel gets caught in that hernia and it then dies and it's a medical emergency. We almost never see that anymore. They take care of fixing, hernias. Not every hernia should be fixed, but they fix those that, medically appropriate to fix, and then we don't have those kinds of things.
But what we do have in corrections, like in the U.S., more cases of young people with colon cancer, like 31-year-old Danny Tran, who is battling stage 3 colon cancer.
Hey, Mr. Thruitt. Hey, we're gonna do our stretching if you want to come out.
It is the afternoon call out for stretching exercises at the El Dorado Correctional Facility's Infirmary.
I've been on level 1 since to relaxing.
There are 26 beds in this infirmary. 18 of those beds have cancer patients, including Danny Tran.
This is helping out, all this?
Oh yeah, it definitely stimulates my stomach and it helps with me passing, and it makes it easier for me.
Good.
Along with medical care, these patients are also part of the hospice program at El Dorado. For the past 4 years, a select team of 5 residents, including Cole Drake and Jay Stanton, would walk alongside and care for their fellow residents who are in need of palliative care or if they are at or near the end of life.
When the program first started, we had more guys that have like Parkinson's disease or dementia and stuff like that. Not a lot of those guys are still here. They've moved to other facilities. But helping with, there for a little while, helping feed a guy with Parkinson's disease because he would shake so much that he could not feed himself. That was a new thing for me to know how to do. One of our patients who was here for a long time had dementia, and towards the end, he was struggling with things like incontinence and things like that. And so to come up in the middle of the night and help clean up the day or, whatever the case may be, but really just for him, call family members just to get them on the phone so that he could then talk to them because he was blind as well. And so those were kind of just some things that you look at and go, someone would do something in this situation, so why not me?
You appreciate life when you see death, and that's so in that regards, I guess it teaches specifically the fact that you're watching people die in prison. It's just that it reminds you that every day, it's a gift from God, and that you even in here you have to make the most of it. Some of these guys, because of what they've done in the past, because of who they've affected, people don't want anything to do with them. But I truly am grateful that I'm the one who gets to care for them if no one else wants to.
The hospice program is modeled from similar programs in other prisons around the country. Each team member was hand-selected for his caring demeanor.
We teach them communication and proper positioning techniques and how to document things that are going on when we really start a vigil on a resident. So we make sure that the communication line between that person who is at that end of stage life, that the residents that are with them are expressing things correctly to the nurses who are coming by to check on them at times.
One of the most interesting things has been over the last couple of years is helping an inmate, like the guy that was blind, helping him call his family. To get them on the phone, I would be the person that they spoke to at first. And so not really forming a relationship, but they would recognize my voice, that we would get to know each other, and I get Christmas cards from them now and things like that, even though he has passed. Those are things that just tell me that, you know, he may not have had someone that could be here physically with him had our team not existed. And that to me, you know, barring some miracles in the courts, I'll be 72 when I'm released from here. And so I have thought numerous times about, you know, there may be a day where I'm the person laying in the bed, not the person sitting in the chair next to him. And so, and just keeping that perspective at all times of, you know, I hope that we're executing this program in such a manner that it still exists 40 years from now, for every guy here in between. And we have a lot of guys on our team that look at this as something that, hey, we hope this outlives every single one of us, for the simple fact that people need that.
For Cole Drake, he likens the work to being a foot washer, an extension of his Christian faith.
Jesus said, you know, the greatest of you will be the servant of all. And so really it is a chance for me to imitate my master and do that, you know. I've scrubbed guys' backs, you know, I've done some stuff I never really thought I would do, you know, as far as that goes, but and caring for individuals. But it really is the most rewarding work.
In part 3 of our checkup on KDOC's healthcare system, a couple nurses and an activity specialist tell us why they think they have the most rewarding jobs in the industry. You won't want to miss it.